on to our next session, Innovations in Technology. It's titled Real World Data and Artificial Intelligence Predictalytics to Achieve at the Point of Care Decision Support. I'd like to invite Bob Gold from GoMo Health and Brian Leclerc from Varian to give the session. Thank you.
Thank you. Okay, Brian and I are going to split the session, so I'm going to go first, and we'll lead into Brian. So before I begin my talk, just a couple notes to really key off the two sessions this morning. The session around clinical trials and the issues with patient engagement, retention, resiliency, applies both in the clinical trial and commercial world. And my talk actually is very much about that. And then interestingly enough, the next talk about physician and clinical burnout, okay, and the fourth aim and the quadruple aim that you saw that was put up about joy in practice, we're gonna touch on that. I wasn't planning to, but I'm gonna touch on that a little bit. One other note, because time is short, just to know, so the word AI was in the title of our presentation, and I'm not going to get into the back science, but the form of artificial intelligence that we use is a form of machine learning that we invented called action response. So it's action response machine learning is the form of artificial intelligence that's deployed in what would be called the bot, like Alexa series of bot. So I'm not going to go heavily into that, but note we can ask questions later on that. Okay, just give you a little bit my background. My science is the science of human motivation, activation, and learning. It uses evidence-based principles from behavioral psychology and cognitive neuroscience, and we'll touch on it a little. We don't have that much time today. And my subspecialty is digital to human activation. So how do you deploy behavioral and cognitive science in technology to activate people and get them more resilient to what they're doing? And that's true whether it's a professional, healthcare professional, or a patient. Okay, so the science is used in over 8 million lives a month in over 20 chronic and complex conditions. It's used in managed long-term care, transitions of care, and gaps in care. It's used by payers, providers, pharmaceutical companies on complex medication therapies and specialty pharmacy. And it's used around the world. And we started, because of all the issues you heard this morning about over 50% of patients aren't adherent to a protocol, the burnout that healthcare professionals are experiencing, we started to teach the science at a couple med schools, pharmacy schools, and master's degrees programs in population health and healthcare administration. Okay. By the way, I added this slide just from yesterday's talk, so I'm not going to talk about it, but a few people presented what you're doing with networks in different countries. Some were informal, some were formal, but there's a component of our science that I'm not talking about today that gets into communities, and it's very disciplined, just like doing cancer surgery on a solid tumor is a disciplined methodology. Building a community, building believability is a disciplined science. And if you don't understand the scientific principles in building that, you're not going to maximize the pathways to success, okay? So if anyone wants to ask me about that offline, you can do that. And so I just started with a quote to tee off what I'm going to talk about, in that individuals are patients, right? Like you said, doctors are individuals. They're patients too, nurses too, okay? And interestingly enough, there's a library building that's correlating stress leading to what's called distress, depression, anxiety, to physical condition management. We're building a large library of that ourselves, and we partner with leading university partners and others to obtain more information in that regard. But the second paragraph gets very interesting, because your emotional state could block a neurotransmitter. So we've seen doctors and nurses not treat as well because of the amount of transactions they had to do in a day, and when we offloaded them using the science, the patient outcomes went up. But you know what? So did their joy in practice, okay? So it's very interesting, and it's sort of an untapped science. Okay, let's get into it. Okay. One thing just to note, caregivers, we try very hard with certain populations, certain people, to get the name of a caregiver, a friend, a family, a son, a daughter, an aunt, a grandma, to help. And it's interesting when you look at lifestyle informatics versus clinical informatics to see those who have a caregiver because they want to help, but they can't call the doctors and nurses all the time. They just don't know how to help. How does that impact patient outcome resiliency, right? Whether that's a clinical trial or a commercial situation. Okay, and caregivers do a lot, especially if you're talking about complex chronic condition management like cancer, why we're all here. Okay, one thing before I get into it, I just want to kind of get everyone thinking a little bit, so get you out of your daily life for a second. And I could tell you, outlook as a state of mind plays significantly in what people are willing to do. Okay, and activate. So you saw the one slide of the physician with the head down. Well, that's patients too, right? So if they don't feel they could accomplish something, if they don't think their outlook's good, they do less of it. Okay, so our science will ask a lot of questions during a protocol and say, what's your outlook over the next 5 years? Doesn't matter what your health condition is. Okay, if someone says, I have a 9, I may have cancer, but I'm going to fight through it, and someone says 2, I feel like a loser,